Dr. Christopher, thank you so much for joining us today. I understand that you came out of retirement because of the COVID-19.
No, I didn't come out of retirement. I'm still very much retired. 3 weeks ago.
So to start off, perhaps you can tell if Malaysia should be taking similar precautions seen in Singapore to combat the spread of COVID-19. For example, the way they've stopped flights from China, as well as they conduct screenings in most places.
Based on the assessment that we have now, we are not yet at that level. My only advice is we need to plan in case situation escalates here, because to implement these things, it's not so easy. It's going to take a lot of planning and coordination within different agencies and different sectors of the civil society. You know, we have to start teaching. We do not want people to panic. Remember, balancing fear of contagion and social disruption. Do we want to be paralyzed completely? I mean, our lives would change immediately. If our lives have to change, it's an Armageddon, the kind of thing, you know, zombie land kind of thing, you know, okay lah, the world will change. But if we do not have to, let's not overdo it. And that balance is important. I think China, Wuhan is the extreme that side. Even the other cities haven't done that, isn't it? I think in Beijing and Shanghai, the big cities, there are only travel restrictions for only certain groups of people, not completely. All right, so Beijing may be relatively untouched yet. So even in China, they are doing different things. So therefore, it's the same thing in Singapore and Malaysia now. We all hope that we don't have to escalate any further. Let's hope things settle. But clearly, I think we need to prepare. We need to plan. What we can do is to educate civil society and individuals, families, what you can do. Having better hygiene will help us now. It will help us also for the next outbreak. I mean, I've been an ID physician since 1992. In that 30 over years, how many major new infections we have got? Out of the blue, Nipah came along. From where? No idea. Then SARS came along. Then there was, of course, Ebola was there earlier. Then you have the bird flu. Then you have H1N1. Then you have MERS-CoV. They're all brand new viruses. No, now we have this. So will there be another one? Absolutely, you can bet your life there will be another one.
Should we be publishing the travel history of those confirmed infected by the virus, so to help people identify if they've come into contact with such people?
I guess they balance between the stigma and discrimination that the public might apply on those places, and it's probably real, all right? But this is something I think that we can speak to the Ministry of Health, I mean, on the reason behind that. But you're right, people might feel uncomfortable that they don't know. Maybe they went to the same place around the same time, perhaps. I agree with you.